Tonight, I'll be in conversation with two experts from the sector of sexual and reproductive health to speak on the issues, data, trends, and legal and policy gaps that exist. I'm pleased to welcome to the show Professor Indralal de Silva, Emeritus Professor of Demography, University of Colombo. Good evening and welcome, Professor.
Thank you.
I'm also pleased to welcome Suchira Suranga, Director, Organizational Learning and Evaluation, Family Planning Association of Sri Lanka. Good evening and welcome.
Good evening.
My first question is to Professor Indralal de Silva. Professor, when we use the term sexual and reproductive health and rights, it's a broad umbrella term that deals with a lot of aspects. So help us understand what are the key components.
Thank you. Yeah. Sexual and reproductive health actually covers the complete area like physical, mental and social well-being, all aspects of reproductive system. And if you take the specific areas, we know that boys and girls, they come to a particular age, then we call the puberty. For females, we call menarche. And then after some time, sizable proportion of them, they develop love affairs and then intimate relationships and sexual behavior. And also some get pregnancies. And then some people use contraception. Some ended up with abortion. And some ended up with violence. And some then continue and then marry, and some ended up with divorce, and then all kind of sexual and reproductive illnesses, diseases, HIV, AIDS, and also reproductive tract infections, STI, AIDS, and HIV, and there are large number of areas basically covers under the sexual and reproductive health. And also there is a component called rights. Rights are basically embraced from according to the whatever the laws govern in that particular country. If you take induced abortion and contraception, now all the countries contraception people can use, but of course there are cultural barriers for young people to use the contraception in some countries, but there is no legal barrier. But some countries induced abortion kind of area is not allowed legally. Sri Lanka also same. Therefore induced abortion is a very important component under the sexual and reproductive health, and also contraception also very important. In broader terms, we call family planning, because some people, even though they get married, they want to delay their pregnancies and childbirth, and some people to just after the marriage, some people want to have children, and some people they don't have to any child. That kind of scenario also emerging in the country. And some people, they don't want to get married at all. Therefore, all kind of groups are there. And also there is another important group, LGBT group. And they are particular group in a society. Most of the time, there is a claim that their rights, their services have been somewhat not provided in up to the scale. Therefore, research is required to understand all those sections, whatever I mentioned. Sri Lanka, of course, had done a lot of research about this area. Therefore, if you want some statistics, I can mention you later on.
Okay, fantastic. Ms. Suranga, could you provide an overview of the role of the Family Planning Association of Sri Lanka? FPA has been around for 70 years. Speak to us about its evolution and what kind of key services are being provided, how mainstreamed they are.
Yeah, as you correctly said, Family Planning Association has started 70 years back on 1953. Can you imagine Sonali, a society where maternal mortality is very high? Number of children with one woman may have more than 10 to 12 children, and with high maternal mortality, and the life expectancy of women is very low compared to the men. So at this kind of society, there was a social cause which to actually to address with women's rights and all. So a group of volunteers started the Family Planning Association of Sri Lanka to address this gap of expectancy at 1953. So at that time there was no any family planning program in Sri Lanka. The word family planning is something new, and government there was no program, and this started as a one clinic, and that expanded to several clinics. Then government started the family planning program, national family planning program. Now the situation is then it's evolved. Government family planning program is evolved, and then government the indicators become very good. I mean for example, maternal mortality rate. Now if you take maternal mortality rate of Sri Lanka, it's very low compared to all other Asian countries, and all other indicators become very good because of these actions that happen. And then FPA Sri Lanka handed over this to government, the clinics and over, and there were still some gaps in some pockets. So FPA Sri Lanka started a social marketing program. So those who can afford some kind of some amount to take family planning, so then the social marketing program is started. Then currently, if you take today the family planning the social marketing program of Family Planning Association contribute around 17% of national family planning program, 17 to 20%. So it's with it's attributed to 17 to 20%. So then today's now we are actually complementing and supporting the government family planning program. Where the government program is not there, we are implementing the family planning program. And then the Family Planning Association, and also this whole discussion at the global level, the broader their discussion, not only the family planning, then sexual and reproductive health. Then FPA Sri Lanka also started its work to address all these sexual and reproductive health related matters and all. And today's we are working on different roles. For example, the maternal and child death, our role is very low because government has very good system, maternal and child death. But when it's come to women clinics and women services like breast cancer screening, pap smear, and cervical cancer screening, those areas there is still gap in Sri Lanka when it comes to the indicators. But the number of cancer cases are increasing. So what we are doing is we are working on these sectors where the government program is not that much of strength. If there is a gap, that we are working on that. For example, youth reproductive health and comprehensive sexuality education, we have a lot more to do in this sector. So what we have identified these gaps of the government program, and we are working on that. And also gender-based violence, and also improving awareness on all these aspects, general awareness and advocacy, especially to the legal and policy changes. And also we are performing as the non-governmental PR, the principal recipients for last 10 years to implement the government strategy on HIV prevention and STI prevention. Okay. So these kind of all these aspects we are covering currently.
All right. Professor, one of society's key stakeholders is its youth. But when we take youth in relation to sexual and reproductive health and rights, we see sexual behavior among youth, pregnancies, abortion, violence. These are just a few of the issues that are being faced by youth. And they oftentimes have nowhere to turn. How do you view this?
Yeah, actually, in any country, youth are considered to be the very important component of that country. Economic aspects are concerned, youth are the cream, and they can develop that whatever the country we're discussing. Therefore, each and every country need to look after the youth very cleanly, and also educate them, and also train them, and then they can be used for the development of the country. However, if their sexual and reproductive health issues and problems are not addressed properly, then there will be a problem. Therefore, we have to consider whether we are looking at the sexual and reproductive health issues of the youth in a right way. Now, if we look at the areas like Sri Lanka, we are observing various aspects of youth which are somewhat vulnerable. If I mention few areas, now in Sri Lanka, some years back, suppose before year 2000, among the youth, now there's another definitional issue. If you consider the youth, internationally youth is considered to be 15 to 24 years. But in Sri Lankan youth policies, they have defined youth as 15 to 29 years. However, WHO and other organizations, they simply take 15 to 24. Therefore, if you take 15 to 24 years of age youth, their love affairs, their sexual behavior, their violence, as you said, very important. Now, one particular area, I am researching on that particular area very much. If you take before 2000, year 2000, somewhere around 1998, among the 15 to 19 or 20 to 24 group, the love affairs are concerned, it was only about 38% of the youth are having love affairs. Among the boys and girls, of course, girls are much lower than 38 before 2000, but by year 2020, among the youth 20 to 24, love affairs has increased very significantly. Now it is love affairs are something like over 85% for the males and female, and also sizable number of males and females, they have multiple love affairs. And unlike in the past, now love affairs has been formed instantly by using internet or Facebook or that kind of areas. Sometimes they never know that particular person. Therefore, what we are observing is that among the young people or the youth, love affairs are being increased very significantly, and there are some vulnerable areas are opening. Now, what are the vulnerable areas? Now, we have studied about this particular matter. Now, apart from the multiple love affairs, sizable number of people have, after one love affair, they enter into another love affair. Therefore, by the time they get married, they have a number of love affairs, they have opened and closed it. Therefore, some of these issues are leading to their marital life. Therefore, we are looking at that particular end. In Sri Lanka, the lawyers are submitting every day 300 divorce cases. Probably all those divorces are somewhat related to their youth, their behavior, their experiences. Therefore, it is very, very important to understand their youth behavior and so on. Therefore, what another extreme area is that among the 15 to 19 unmarried youth, 15 to 19, their sexual behavior is concerned. About 15% of this unmarried 15 to 19 boys already have sexual intercourse experience, penetrative sex. Among the 20 to 24 unmarried males, almost 30% of them have sexual intercourse experience. Therefore, it is very high level we are observing sexual intercourse, but majority of they are having sexual activity, sexual intercourse with their lover. The danger part is that apart from having sexual activity, sexual intercourse, apart from the lover, sizable proportion engage in sexual activity, sexual intercourse with the sex workers, and sometimes even unknown person. That's the real danger. Therefore, we are observing that in Sri Lanka, HIV, STI, sexually transmitted infections, those numbers are rising very significantly, because it is very difficult to control. Parents do not have that much authority, I would say now, because after the COVID, the youth got very good benefit through the education and other things, use of mobile phones and all other things. They can form the love affairs, and also they can search everything from the internet and the YouTube platforms. They notice whatever available and they try to experiment those things. Therefore, probably the family system is somewhat deteriorated due to various reasons. Therefore, control coming from the family is somewhat weak. And also, we will come to the next one, the school education and the reproductive and sexual education. But we are observing that youth are becoming somewhat vulnerable in Sri Lanka.
So, Suchira Suranga, Professor Indralal alluded to the vulnerability of youth. What kind of programs does the FPA have to educate youth?
Actually, the youth is the area we call screening age. So, adolescents and youth. So, we need to start all the interventions when they are at the youth, because all these patterns and their personality develop at that time. So, what we are doing currently is that it's two aspects, that we have developed a curriculum for FPA Sri Lanka to implement sexual and comprehensive sexuality education. So it's when we call comprehensive sexuality education, it's not that one curriculum for all. It's age specific. For example, for adolescents, then when they come to the higher education, it's different. Then after the school, it's different. So this age specific sexuality education program that we are doing in schools and out of schools. Sometimes we discuss with the Ministry of Education, and we conduct in schools program for sexual and reproductive health for the youth, both girls and boys. And also one other area is that we are doing sexual and reproductive health programs, especially the CSC program, the comprehensive sexuality education programs for university students, as well as some training students, those who are within the youth group but not in schools. And also one other thing is that when we focus on youth, they have this requirement for the SRHR services, but those requirements do not come out because of these cultural and some normative issues, because they think that if they go to kind of to take these services from the government system or from the private practitioners, it's they may be somewhat stigmatized. So they do not go to these kind of the normal systems to get their the requirements. So we have started some youth friendly clinics at our SDPs, our service delivery points, so they can come without any problem, and then there are counselors there, so they can discuss with counselors and express their all the issues and all, and then take services. So these kind of these kind of interventions are going on, including youth camps.
Right, but these are ad hoc interventions, right?
Not really ad hoc interventions.
Do they happen across the board?
Not across the board. We are working on we have 10 SDPs in service delivery points. Sorry, and it's come to SDP service delivery points in 10 districts of Sri Lanka, especially where there is a high need. For example, some of our service delivery points are situated in free trade zones, the Koggala free trade zone and Sitawaka and Watupitiwala, and we are going to open one in Kundasale now. So we are targeting where there is a risk and where there is a high level of importance. But as you correctly said, as one organization, we cannot implement the kind of to reach all the population in Sri Lanka.
Absolutely.
So, yeah, there must be a program to reach all these youth.
Professor, we are in year 2024, and there is a massive pushback against the schools having comprehensive sexuality education, and we have this pushback due to various pseudo-religious and pseudo-cultural reasons which have no scientific basis. So we're in a situation where Sri Lanka is in crisis as a result of gaps in sexual and reproductive health and rights, with the youth and other sectors of society being made so vulnerable. And on the other hand, we find these busybodies objecting to scientific, age-appropriate, comprehensive sexuality education being properly implemented in schools. How do we bridge this divide?
Okay, Sona, it's a good question. It's required a little bit of concentrate on the education. Now, in Sri Lankan education concern, sexual and reproductive health education, basically they call the reproductive health education. Sexual part is somewhat very low. From grade 7 and onward it's continue. But we still don't have the comprehensive sexual education. And also this the reproductive health education is concerned, it is not a compulsory also. It's a basket subject, right? And also I'm first indicating the barriers. Now we don't have a sufficient number of teachers, qualified teachers, trained teachers to teach this particular subject. Therefore, that's a number one. Therefore, teachers, those who are qualified and trained also, most of the female teachers, they tend to skip some of the sections which they may find embracing to them. Therefore, they never teach that part. They ask students to, okay, you look at page 20 to 24, you can understand. Therefore, students are not getting scientific information about whatever the particular area stated in those pages. Therefore, and also there is another important issue. Sometimes this particular subject matter is taught by the teacher who is teaching history, or teacher who is teaching the geography, but not the biology teacher or someone, because we don't have sufficient number of that qualifications with the teachers. Therefore, that's one problem. And also this sexual and reproductive health education, comprehensive one, is concerned, most of the time authorities were somewhat reluctant to include contraception particular section. They have mentioned that one, particularly the devices, whatever the techniques you can apply, they think that it may be, for example, condom. They think that it may be not appropriate to include how to use, what is the use of contraception, those things are not mentioned.
Although the data suggests that when young people are equipped with the knowledge, then they delay sexual activity.
That's right.
And they are more careful.
Yeah. But now the problem is that even though school curricula, teachers are not teaching that particular subject matter, they can get all the information from the mobile phone. Now the issue is that during the COVID-19, students were given mobile phones by the parents, and they are now expert on how to get the various websites and also YouTube material and so on. Therefore, they observe not the scientific information about the sexual and reproductive health, but they observe somewhat, blue films or somewhat demonstrating sexual behavior, multiple sexual activities, or all kind of somewhat vulnerable videos they observe. Therefore, they think that these are the sexual and reproductive health information. But what is required is a trained teacher need to explain these are the human reproduction systems, these are the organs, how reproduction take place. These are nothing, but you have to learn along with your education. You will understand those things and explain one by one. But most of the teachers, as I said, they skip. Therefore, students have a chance of getting information from the internet and other, particularly the boys get the information from the boys.
And also pornography doesn't contain compassion, respect, care, dignity, which is why it's so important to not let our youth get their primary education from unauthorized, trafficked this kind of videos.
Yeah, that's correct, Sona. That's another important thing. In our education system, students are given tuition and they were asked to, study only the main subjects. Now, suppose you take the O-level student, they were asked to study the main subject like Sinhala or English or whatever the medium, and whatever the main subject, they have to complete all those things until up to grade 11. Therefore, they study that, go to the tuition, only the main subject. And schools also, they concentrate on the main subjects where they can go to the A level and then from to the university. Of course, the students in the biological streams, after grade 11, 12 and 13, they understand all these subject matter what I mentioned. But students in the commerce, management, arts and engineering kind of, technology students, they never get this dose completely. Therefore, they are every time getting information from the internet, which is very vulnerable.
We are in conversation with Professor Indralal de Silva and Mr. Suchira Suranga. We're going for a short commercial break. We'll be right back.
The People's Platform.
Companies play better politics than the politicians of today.
We are not supposed to play with the people's expectation. Then it will be a huge disaster.
When you're bankrupt and when you're going to bankruptcy, two different.
The grandfather is saying it is going to take this long. What does he know?
It's about the lack of sense of humor in Sri Lankans.
Issues that matter the most. Unfiltered discussions. Real answers. Face to face. Monday to Thursday at 8 p.m. on TV1.
First in your heart. Sri Lanka's #1. The Sirasa Media Network.
ජාතික මෙහෙවරින් අපි කතා බහ කරන්නේ පුරුෂ පාර්ශවයට කාන්තා පාර්ශවයට වෙනසක් නැතුව ආයුර්වේදයට අනුව ලස්සන වෙන්නේ කොහොමද කියලා.
හොඳම මොයිස්චරයිස් එක තමයි කොමඩු.
යම්කිසි වයස් මට්ටම් වලට පැමිණෙනකොට ඇතිවෙන බෝන් නොවන රෝග තත්ත්වයන් තුලදී කොයි ආකාරයෙන්ද ඇස ආරක්ෂා කරගන්නේ?
බහුලවම අන්ධභාවයට පත්වන රෝගී තත්ත්ව ගත්තොත් ඇත්තටම ලෝකේ ලංකාවේ දෙකම නම්බර් 1 ඇත්තටම තියෙන සුද ඇහි සුද.
නිරාමිෂ සිතුවිලි වලින් තමයි පිබිදෙන්නේ. ඒනට ප්‍රශ්නේ ටික වෙලාවක් යනකොට වෙනස් පැත්තකට යන්න පුළුවන්.
මූලික අරමුණ සියදිවි හානි වැළැක්වීම වුණාට ඕනම කෙනෙකුට ඕනම ප්‍රශ්නයක් ඕනම ගැටලුවක් ගැන කතා කරන්න අපිත් එක්ක යොමු වෙන්න පුළුවන්.
ජාතික මෙහෙවර සතියේ දිනවල උදෑසන 11ට. The People's Platform.
Welcome back to the show. I'm in conversation with Professor Indralal de Silva, Emeritus Professor of Demography, University of Colombo, and Mr. Suchira Suranga, Director Organizational Learning and Evaluation at FPA Sri Lanka. Professor, let's talk about the shifts in demography in Sri Lanka. In the recent past, we've seen a significant drop in births, a significant drop in marriages, declining labor force. We have hosts migrating. We have an aging population. We have a rise in deaths. These are the figures that are being reported. Speak to us about what we can make of these trends.
Yeah, thank you, Sonali. I think first we better understand what is going on. Now, some time back, we projected that Sri Lankan population will increase to 24 million, 25 million, even to 26 million by 2050 or 2060. But now we are observing Sri Lankan population is declining. From year 2022, continuously, 23, 24 also we are observing decline, and also definitely year 2025 also we are going to observe decline. Now, what could be the reasons for this is we are trying to find out. The number one is that we are observing very significant drop in reproduction. That means production of live births. Now production of live births, how much decline? If I give you some statistics, 2015 to 2019, of course, births has declined, but that was only 4%. 2019 to 2023, the drop was more than 23%. Therefore, very large percentage before COVID to economic recession and 2023, now we are observing very significant drop. Now, there are many reasons if I mention few things. Now, sizable number of young people, they don't want to get married due to economic recession and so many other things. And also some of them want to go abroad. That reason, they also do not want to get married because that's going to be a barrier. And also those who are having one child, they don't want to go for the second child. Children are quite expensive now. Therefore, value of children has declined. And also the real value of the money has declined. Therefore, and also our labor force is concerned, largely males are working. The females working in the labor force is quite low, only about 33% of the females are working. But males are working, no doubt. But since the females are not working, there is no income to the family. Therefore, only the husband is getting income. Therefore, they tend to reduce the births as much as possible, and also it's their right if they want. No one can say that is a wrong thing, but they can do it. But on the other hand, the deaths are rising very rapidly. Again, the same period 2015 to 2019, deaths has increased, no doubt, by 5%. But 2019 to 2023, the volume of deaths has increased by 25%. Therefore, this is the era we had the COVID. Only 2021 only we had about 16,000 COVID deaths. Apart from that, 22, 23, even 24 we are observing rising deaths very rapidly. Therefore, question comes, why the deaths are rising that rapidly? There are many reasons, of course. If I mention few things, non-communicable diseases. Now, those days people tend to die age 65, 70 or even on 80. But now people are dying age 40, 45, premature deaths. We call the premature. Probably it is related to some their stress levels, diabetic, hypertension, cancers, all kind of problems are there, and also nutrition problems are there, and probably the inferior quality of the medicine also may be reason. And also we don't know whether the COVID vaccine and also COVID virus, whether it has any impact on these kind of deaths. But unfortunately, we don't have any good research to show that these are the clear factors. However, once the number of deaths are increasing, one may say that it is due to population aging. No, population aging can contribute to about 5% of the increase in the deaths, but not the 25%. Therefore, it is very, very important to find out why premature deaths happening. Other important point is the large volume of young people and the professionals are leaving the country. Therefore, simple selection matter, if you select those who are very healthy, they are leaving. Therefore, somewhat unhealthy are remain here, right? Therefore, naturally, they are more bound to die sooner. Therefore, by taking all these parameters, we are observing population decline. Why? Births are declining, deaths are increasing, and large number of people are going out rather than coming in. Therefore, that has the implications on our labor force. Once our labor force is declining, that means our production cycle will slowly drop. And we have other problem, as I mentioned earlier, females are their participation is very low. Therefore, coming era, we are observing that we have to pay a lot of loans that we have taken, and all those things are there. The economy is going to be somewhat very difficult for the entire country. And in the same time, demographic picture, and another point I forgot to mention, that population aging. By another 5-10 years time, in the population, there will be around 25% of the population will be 60 years and above, where they require all kind of support and the people in the labor force, they will be not able to support them. Right now also there is same thing happening, but it will be more serious. Therefore, Sri Lankan government also will not be able to tackle the situation. But that's why we require the good policies and planning by looking at the data and research information, take the proper action and develop proper policies and educate about what is going to happen.
So, Professor, just a follow-up question. Could you educate us on as to whether this data is being collated somewhere, being given to policymakers in order for them to plan for the next 5 to 10 years?
Yeah, that's a very good question, Sonali. Now, problem is that this information, what I am saying, is something very new.
Okay.
We are obtaining all this data from the Registrar General Department about the deaths, births. They are the authority to collect all the information. Unfortunately, we don't have very good statistics about how many students are migrating, how many people are coming back, the labor migrants, and some people going permanently for other countries. We don't have good data. We are only estimating. Sri Lankan major problem is that we don't have a good databases to do something systematically. We do have policies. Now aging policies we have, labor force policies we have, but not tackling the current situation, but the past situation. But the problem is that policies we have, but the implementation part is very weak. There are no implementation programs.
Mrs. Suranga, the FPA recently concluded a major conference on SRHR. Speak to us about this conference. What were some of the findings, and what kind of steps are you planning to take in consultation with government and other stakeholders in order to implement these findings, recommendations? Speak to us about all of this.
Yes, Sonali, actually, I'll start where Professor Indralal stops. There is a high gap in data in SRS sector in Sri Lanka. We can understand that conducting research in sexual and reproductive health is not, it's difficult than conducting research in other areas, because people do not want to disclose all these sexual behaviors, all these sexual matters and all these family related issues and everything with others, even with the kind of even in surveys and all. Still, other countries are doing much better than us when it's come to developed countries as well as when it's come to other countries. And we wanted to have a kind of dialogue to improve our research and improve not at FPA but at the national level, to improve the research and to address this research gap. So actually in Sri Lanka, there was no very good platform to discuss these things, to present these things. When there is no good platform, researchers do not want to enter to do researches on that area. So we identified this gap of research, and we wanted to create a kind of platform where all the policymakers, researchers and the academia come together and discuss their research, whatever available, and identify the gaps of the policies and legal, and identify how we go forward. So the Reproductive 2024 is a kind of just start of that journey in Sri Lanka. This is the first ever conference, international conference, that was conducted in Sri Lanka to address this research gap of the sexual and reproductive health. So the Reproductive conference, there were around 400 delegates, including over 100 delegates from around 25 countries. We had over 100 speakers from different sectors over 100 speakers from different sectors of SRH come together and discuss about various issues related to, starting from sexual and reproductive health of young people, and then diversity, inclusion, and then gender-based violence, then child marriage, menopause and aging related issues, women cancers, breast cancer and cervical cancers, and family planning. All these areas we discussed during last 2 days. there were more than around 21 discussions or sessions and more than 50 actually we received a good response as well. We didn't expect that much, but we received more than 150 abstracts of research from different areas, starting from medical students and also medical researchers, and then demographics and legal background, and we received this, and they presented their research, and we come up with some gaps that Sri Lanka have, and Sri Lanka as a country, as a nation, not only the government but all the civil society organizations and also the academia and also researchers should focus on. For example, now everyone is saying that we are also discussing that internet has become a problem and mobile use has become a problem. Still, there are some opportunities is coming on in the health sector because of this high internet usage of the even children, kind of digital health intervention. Now the cost of internet and information is going down. Earlier, if we consider the cost of giving information to the people, it's very, very high. Now it's not that. So why we cannot use this as an opportunity to educate especially young people with digital health interventions? So you don't want to every time come to a clinic or come to a service provider. Still we can educate them and counsel them at the place that they are in. And also we can, for example, HIV testing. Now we have started in Sri Lanka. It's good that we have started. There is the National STD/AIDS Control Program. There is a site called Know For Sure. If you want to test HIV, you just go there and just you don't want to give your names and all. Just type there and the HIV test kit come to you, the self-test kit. So you can perform your test, and a service provider will call you and give the instructions and give you the pre-test counseling, and then you can perform the test and give you the post-test counseling. So this is where the global health sector is moving. So we identify this as a very good opportunity for Sri Lanka, because more than other countries, our population is highly educated, and our population is using mobile phone, smartphone. So this is one area that we discuss. And also more inclusive laws. For example, there are some laws which are not inclusive, which are not right focused, right based, and so these kind of laws and policy reforms are needed. And also some programs we haven't. For example, subfertility. There is no program, government very established program for subfertility to address subfertility clients, and only the private sector programs are available. So we need to start some kind of program for these couples and all, and identify how how at least up to some extent to give them the primary the basic services as well as some advanced services, at least for identified couples. And also SRHR issues related to aging. Now, as Professor Indralal said, our population is getting age, and with this aging population, whether we don't have currently, there are ad hoc program here and there, but this menopause related issues are there and aging related issues are there. We don't have a good program at the national level. But when this population is aging, next decade we need to focus on how this aging population keep productive for next another 1 or 2 decades to make them for the economical reasons, for the economical to get the contribution from economic, and as well as to keep them healthy. So this area that we discuss, and also we discuss some areas like comprehensive sexuality education and diversity and inclusion, like LGBTIQ people, how we can give the same service others are entertaining to these kind of people as well.
Professor Indralal, how can the integration of sexual and reproductive health and rights into national policy frameworks contribute to broader social and economic development in Sri Lanka? What are the gaps that we're seeing in our laws and policies? How do we bridge this disconnect?
Well, of course, under the Health Ministry, there are number of policies are there. 2018 to 2024, as I remember, there was a policy looking at the SRH also. But the problem is that I think I already like mentioned earlier. Now the policies are there. Now Health Ministry is the one having large number of policies. Of course, they are implementing most of the things in a proper way. But this SRH matter is very difficult. Now I can give you a simple example. Now Sri Lankan law says induced abortion is technically illegal. Only the mother is going to die because of the pregnancy, then only the medical experts can recommend it for the termination or the induced abortion. But Sri Lanka, we know that whatever the law says, people, they take all kind of pharmaceutical products and then they enter into the particular era called termination of their pregnancy. Therefore, law says something and the practice is something. The problem is that we don't have a good data and the information about what is happening. Because the legal terms, it is totally legal. But researchers also somewhat reluctant to collect the information about these illegal matters. Those are the things. Therefore, policy development, we require now say for a simple example, suppose you ask from the Education Ministry, how many teachers are qualified to teach SRH? They will say almost 90% qualified. But we know that they are skipping some of the sections. But to capture that one, it is not easy. Because they may be qualified even. But it is therefore preparation of policies and also preparation of policies should be holistic now. Now if you take this particular subject matter, it deals with so many areas together. But Sri Lankan problem is that ministry develop a particular policy for only that ministry. The intersectoral kind of activities are so poor in Sri Lanka.
What is the way forward?
Way forward is that as Suranga mentioned, that these are the information we released from the conference, and even Health Secretary and so much of other senior officials were there in the conference. We have presented these ideas. Now say for a simple example, if you take non-communicable diseases, Health Ministry can't tackle that one alone. Why people eat all kind of junk food and poison food? Because there is no control of foods in Sri Lanka. Now drug and food control authorities very poor in Sri Lanka. But Health Ministry can't do all those things. Customs and so many people somehow bring all kind of food. Therefore, we need to have to control the non-communicable diseases. Number one is the food. But unfortunately, people eat all kind of junk food everywhere. Therefore, Health Ministry can't tackle. Health Ministry can give only the medicine once they are sick. But prevention part need to be tackled by so many other ministries. But Sri Lankan political system is that ministries work separately. There is no integration. But if you go to India, it is very different.
Okay. What do you think needs to be done in terms of action to be taken?
Yeah, actually, it's not that when it comes to sexual and reproductive health, it's not that one party can do it. Because it's a kind of multi-sectoral engagement, and as well as we all have, for example, you and me, we all have a role to play when it's come to the sexual and reproductive health. For example, as a mother, you have a role to play to educate your young people on what is bad touch, what is good touch, at what time you should go to this, and empower them to take the decisions and all. And also the civil society organizations, when it comes to civil society organization, they need to identify these data and then they need to make a voice of what has to happen. And also when it's a governments need to prepare the policies, as well as the implementation is very important. along, and this implementation also should happen with the civil society organizations and academia and all the sectors. And also when it's come to the allocation of budgets and all, these kind of issues are identified, these sexual issues, because people do not voice over that. No, if you have some sexual and reproductive health issues, you normally even do not tell to your very close friend, and to academia and to media, and also these issues are very hidden, but the repercussions are coming out, but the issue is very hidden and do not come out. So the government and all the stakeholders do not identify the significance of the issue unless it is come out from the research and all. So when it's come to budget allocation, when it's come to other kind of the decisions, these issues are not given the importance that it should receive. So and also the sexual and reproductive health always attach a kind of stigma and discrimination, which has created a place where there is no dialogue at all at any level, at the policy level and at the personal level, as well as at the education level. So this needs to be created, where we need to have academia and media has a very prominent role where, and also social media, to discuss these things. So thank you very much for come up with this program to discuss all these the hidden things and the data with data and all.
All right, thank you very much, Professor Indralal de Silva and Mr. Suchira Suranga. Thank you for this conversation.
Thank you.
Thank you.
Thank you for watching us. We'll see you again next Friday. Good night.